All right, well, welcome to this episode of Medical Rounds, where I will answer the questions, which medications to avoid with a patient who reports a sulfa allergy and why. This question matters because in my 30 years of practicing as a nurse, a pharmacist, and a physician, I've encountered the reporting of sulfa allergies by patients, which do represent up to 6% of the population. I've also witnessed what happens when the wrong medication is used in a patient with a true sulfa allergy. Reactions like Stevens-Johnson syndrome, toxic epidermal necrolysis, even cases of Stevens-Johnson's involving the eyes. Now, it is essential, guys, that you hear this. Not all sulfonamide medications are equal, and thus do not share the same risk of allergic reactions or even cross-reactivity. As a result of this fact, I have seen when clinicians misunderstanding the designation of sulfa allergies and avoid an entire class of medications. Guys, we should not practice in ignorance. Instead, we should practice in the context of the best available evidence, recognizing that we may not still know everything there's to know, and we may need to still take some precautions. Hey guys, I'm Dr. Busti, and welcome to This Is Why, a show dedicated in helping healthcare professionals understand the why behind the clinical decisions we all make. Because when you know the why, you can master how to provide the best care to the patients that we all have the privilege to serve. By the end of this review, you will not only know the answer, but understand why certain sulfonamide medications are worse than others in the proper context of the best available evidence. But I'm also going to do something else. I'm going to provide you with the list of the most common drug classes and medications that contain sulfonamide groups. I'm also going to show you an example of how some of these agents are not the same. All right, guys, let's jump in, okay? So the real why behind the answer to this question is seen when we simply look at a few chemical structures. Now listen, I have no interest in turning this into a scary or intimidating chemistry discussion that could cause PTSD for many of us, okay? Yeah. But just giving you a list of medications doesn't mean you know why some medicines could be more concerning if used in a patient with a true sulfa allergy, okay? All right, so the risk of allergic reactions is really about the orientation of this sulfonamide group to the other chemical groups in that drug's structure. This is similar in concept to, guys, listen, when we understand patients who have a penicillin allergy and understanding that cross-reactivity between penicillin and cephalosporin agents. So one of the things that we have provided you is here a number of figures and structures, again, not to complicate things, but just to keep you oriented. These images are available at thisiswhy.health for free. Feel free to use them to study. Feel free to use them and share them with your friends, colleagues. If you are faculty, preceptors, and you teach, they're there for you for that purpose. So on this particular image here, you see that these are the various sulfa structures, things that you see out there, how sulfonamide groups are made. Now, I'm not diving in here to all the chemistry, but fundamentally what we need to recognize is that there is a sulfonyl group, which is here outlined in this green shaded area, okay? And you can see it again up here. But you also need an amino group. An amino group comes from a structure typically that contains an amide, right? Amides actually are NH2 structures that are attached to our carbonyl group, okay? Now, all drugs that would be labeled as sulfonamides have this, and that's what it ultimately forms. Now you see an arrow here with some dashes, But again, I'm not going through chemical reactions and all this stuff, but you will see some of these terms if you kind of dig into this subject further, and you will also see things about the chemical reactions. I'm not trying to get lost into that, but rather simply to understand why we call a drug a sulfonamide. So the chemical structure needs to have this in it, okay? Now, as I said before, what matters is the understanding of this particular group, its orientation around other chemical groups within that pharmaceutical, medication, or drug structure, okay? So let's start to pull that together. On this particular image that we are providing you here, you see that this is a drug molecule. It's actually sulfamethoxazole, okay? But it contains that very important sulfonamide moiety in the middle, okay? Again, shaded in the green, okay? What you see in that orientation around that group is a N4-arylamine over here, which is a 6-member ring. Okay? And then you also see over here on the right side an N1 substituent, which is a 5-member ring. And those two structures are very important to recognize the risk of allergic reactions as well as the cross-reactivity that can happen when agents that have these sulfonamide groups share similar structures, especially to a drug like this one, which is sulfamethoxazole. Now, sulfamethoxazole is commonly combined with, as many people know, trimethoprim, and that is known as Bactrim. And when that concentration and the formulation is increased, that can be Bactrim DS, which stands for double strength, okay? But it's important to recognize the sulfonamide group and its orientation around other chemical structures. Now let's look at a list of medications that are considered to be sulfonamide containing medicine. So in this table, what I've tried to provide for you, which is a fairly comprehensive list of the drug classes by kind of types or larger categories of drugs. So on the far left, we have sulfonamide antimicrobial agents in this lighter blue column. And then to the right of that, you see sulfonamide non-antimicrobial agents. That's actually really important, okay? That is where some of those structures in the N4-arylamine and the N1 substituent are varied. And that variation changes the cross-reactivity or allergic reactions that could occur within a class. And this is one of the reasons why you don't want to just throw the entire class away, because what you see in some of these drug classes is that we don't have all the drugs that make up that drug class. And the reason we don't have all the drugs in there is because they're not even sulfonamides. They don't have the sulfonamide moiety. These are the drugs by drug class, okay, and I try to put it in alphabetical order, okay, going from left to right. So we have alpha-1 blockers like tamsulosin. We have anticonvulsants, zonisamide, the BRAF inhibitors, and we have carbonic anhydrase inhibitors, both that we give orally, IV, and even topically in the eye, okay, things like acetazolamide. COX-2 selective inhibitors known as Celebrex, right? HMG-CoA reductase inhibitors, even known as rosuvastatin or Crestor, which is very common. Loop diuretics, PDE5 inhibitors, on and on, thiazide, sulfonylureas. I mean, think about the name of that, the sulfonylureas that we don't use as much compared to historical perspectives in the management of type 2 diabetes. But glipizide, glimepiride, glyburide, those are important. They contain a sulfonamide moiety. And then other drugs like probenecid and even dapsone. Now, dapsone contains a sulfone group, not necessarily a sulfonamide group. And so it's just I put it there for just to be complete, okay? But this table, again, is available for you at download at thisiswhy.health, okay? So hopefully that's helpful for studying, but it's also a quick reference in everyday sort of things that we have to try to make decisions upon. Now what I'd like to do is switch to an example and show you of a antimicrobial sulfonamide on the left, which on this particular image you see is sulfamethoxazole, okay? And then on the right side of the screen there in that image, you see it's hydrochlorothiazide, one of our thiazide diuretics. And you can see that hydrochlorothiazide does have that sulfonamide moiety, but it doesn't have the N1 or N4 groups in that orientation similar to sulfamethoxazole. And as a result of that, okay, having no shared groups, we have to think about, well, what is the risk of this? Well, we get that answer from the evidence. And there have been a few case reports in the literature that raise a concern. But remember, guys, case reports do not prove causality. They lack the sufficient amount of internal validity in most cases to do that. Now, that doesn't mean case reports bear no value, okay? But we must be careful in using the word cause, okay? So while there's a potential risk of allergic reactions when using drugs like HCTZ in patients with a reported sulfa allergy, the real world risk appears to be very low, especially when you put that drug in a context of its history and use on the market. Same with other drugs like loop diuretics, where technically ethylcrinic acid has been reserved. Now guys, I have never once in my entire 30-year career ever administered, seen, ordered ethylcrinic acid, okay? So it doesn't mean that it has no value or bearing. I'm just saying that that correlates to some degree that if it was that relevant and it showed up that much in sulfa allergic patients, we would probably, in my 30 years of nursing, pharmacy, and medicine, I would have seen it, dispensed it, prescribed it, administered it in some form or fashion, and I just haven't. And I've taken care of a lot of patients with reported and very well-known sulfa allergies where I had to consider that, and I had to maybe counsel them, and I maybe had to monitor them a little bit differently. And that's what you should do, right? All right, guys, well, I hope that you found this information helpful. Please subscribe to my YouTube channel, and please give us a like so that we can continue to provide this type of content for free. I also offer free membership over at thisiswhy.health, where you can access the downloads to those images, get coupons for discounts if you need test prep, right, products. You can submit questions, access unique playlists, collections, and things that are not found on YouTube. Okay, guys, thanks so much for joining. We'll see you next time.